Hello everyone, I am Nafisa Parveen and today we will know about diarrhea. There are many types of diseases of the gastrointestinal tract. Diarrhea is a common illness. It is not a disease in itself but a symptom of other diseases. Now, what is the definition of diarrhea? It is the passage of stools with increased frequency, fluidity or volume compared to the usual pattern for an individual. That means in diarrhea, the stool contains more water than normal. Diarrhea is very common among infants and children, and if neglected can lead to dehydration due to excess loss of water and electrolytes from the body. Three clinical syndromes of diarrhea are acute watery diarrhea, dysentery, and chronic diarrhea. Acute watery diarrhea refers to passage of loose or watery stools without visible blood. In this case, vomiting may occur and fever also may be present. If diarrhea occurs more than 14 days, then it is called persistent diarrhea. Now there is dysentery. It is a condition which is characterized by inflammation of the intestinal mucosa, especially of the colon, with abdominal pain, tenesmus and passage of watery stools frequently containing mucus or blood. Two main types of dysentery are bacillary dysentery and amoebic dysentery. Bacillary dysentery is caused by the bacteria of the genus Shigella, and amoebic dysentery is caused by the protozoa Entamoeba histolytica. Bacillary dysentery is characterized by sudden onset of colicky abdominal pain, tenesmus and passage of small loose motions with blood 5 to 50 times daily. And amoebic dysentery is characterized by cramping pain in the central and lower abdomen, followed by passage of watery stools containing a large quantity of mucus, and a small quantity of blood may also be present. Chronic diarrhea. It is recurrent or long-lasting diarrhea due to GI tract motility dysfunction such as IBS, that is irritable bowel syndrome, malabsorption, metabolic disorders, food intolerance such as lactose intolerance, food poisoning, infections and human immunodeficiency virus or HIV infection. Osmotic diarrhea is characterized by passage of large, frothy, explosive and acidic stools. Now, why the diarrhea is happen or what are the causes of diarrhea? When weaning food is introduced too early in infants, ingestion of undigestible food, poor food hygiene, improperly handled food, food intolerance or food allergy, food poisoning, viral infection, for example, rotavirus infection, bacterial infections, for example, Shigella, protozoal infestation as by amoeba, and others. When acute diarrhea happens, what treatment should be followed? The most important factors in the treatment of diarrhea are to prevent dehydration from occurring if possible, to treat dehydration quickly and well if it does occur, and to feed the child. If dehydration occurs, then oral rehydration therapy or ORT with a solution made with rehydration salts or ORS is the best treatment for dehydration. The composition of oral rehydration salts or ORS are available in the market in a dry packed form. ORS should be started as the child passes even one watery stool and should be given as frequently as possible. Composition of ORS as per the standard of WHO and UNICEF is as follows: sodium chloride 3.5 grams, sodium bicarbonate 2.5 grams, potassium chloride 1.5 grams, glucose 20 grams, and these components are to be dissolved in 1 liter of clean drinking water. Other fluids which may be given along with ORS are coconut water, whey water, barley water, pulse water. Small amount of nutritious and easily digestible foods should be given frequently to the patient. After the treatment of acute watery diarrhea, now there is dietary management of chronic diarrhea. So what are the objectives of dietary management of chronic diarrhea? First, to meet the nutritional requirements. Next, to maintain water and electrolyte balance, to provide extra nutrients, to compensate for losses and to reduce residue to minimum levels. Energy. Energy requirements are increased by 10 to 20% to meet the losses during diarrhea as well as overcome weakness and loss of weight. Proteins. An increase of 50% in protein intake is essential to build up body tissues and replace the tissue breakdown which has occurred. Soft boiled egg, buttermilk, skimmed milk and milk preparations should be given. If the patient suffer from diarrhea due to lactose intolerance, then milk and milk products should be avoided. Carbohydrates. The intake of carbohydrates should be increased to meet the high energy requirement. However, the fiber intake is kept to a minimum 1 to 2 gram per day to give rest to the intestines. Fats. Emulsified fats like butter and whole milk may be given as they are easy to digest. Coconut oil may also be included in the diet. Minerals. Calcium and iron rich foods should be included in the diet. Foods that are rich in vitamin A are recommended. Vitamin B should be given. Vitamins are incorporated in the form of oral or parenteral management. Fiber. Low fiber foods like refined cereals, bread, semolina, washed pulses, vegetables like potato, pumpkin, bottle gourd, fruit juices and fruits like banana, papaya should be given. Apple can be introduced in the diet when the condition is improved. The foods that are allowed in diarrhea are washed pulses, refined cereals, well cooked vegetables, banana, papaya, milk products such as curd, paneer, egg, chicken, fish, and others. The foods that should be restricted from the diet in the case of diarrhea are fibers or cellulose containing foods, raw vegetables, salad, dry fruits, fried foods, pickles and chutneys, spicy foods, foods with lots of sugar, caffeine containing beverages, and others. Now we are done today's topic. So thank you for watching.